Assalamu alaikum. I am Fatima and my roll number is BP1450093 and I belong to group 58. My topic name is Route of Drug Administration. Route of administration. Drug can be administered by different routes depending on the characteristics of drug and condition of patients. Routes affected by the following factors: characteristics of drug, emergency, routine use, site of action of the drug, local or systemic, condition of the patient, age of patient, effect of gastric pH, digestive enzyme, and first pass metabolism, patient's doctor's choice. Route is divided into two types, local and systemic. And systemic further divided into parenteral and internal. Parenteral involve inhalation, injection, transdermal. Internal involve oral, sublingual, rectal. Local route is the simplest route of administration where the desired action is required. Include the following: topical, intra-arterial, deep tissue administration. Local route includes oral cavity, GI tract, rectum and anal canal, eye, ear and nose, bronchi and skin. Systemic route include the internal and parenteral, and internal route include oral route, sublingual route and rectal route. Oral route is the most common and acceptable route. Dosage form: tablets, syrups, capsules and mixtures. Advantages are safer, cheaper, painless, convenient for repeated and prolonged use. Disadvantages: it is not suitable for unpalatable, highly written drugs, unabsorbable drugs, drugs that are destroyed by digestive juices, drugs with extensive first pass metabolism, unconscious patients, unoperative and unreliable patients, patients with severe vomiting and diarrhea. Sublingual route: the preparation is kept under the tongue. Drug absorbed through the buccal mucous membrane and enter the systemic circulation directly. Advantages: quick onset of action. Action can be terminated by spitting out the tablet. Bypasses first pass metabolism. Self-administration is possible. Disadvantages: it is not suitable for irritant and lipid insoluble drugs, drugs with bad smell and taste. Rectal route suppository can be used for local effect as well as systemic effect. Retention enema can be used for local effect as well as systemic effect. Parenteral route includes the inhalation, injection and transdermal. Inhalations is the volatile liquids and gases are given by inhalation for systemic effect. Advantages: quick onset of action, dose required is very less, so systemic toxicity is minimized. Amount of drug administered can be regulated. Disadvantages: local irritation may cause increased respiratory secretion and bronchospasm. Injection. Intradermal route: the drug is injected into the layer of the skin. Bacillus, calmette, Guerin, vaccination and drug sensitivity test. It is painful and only a small amount of the drug can be administered. Subcutaneous route: the drug is injected into the subcutaneous tissue of the thigh, abdomen and arm. Adrenaline, insulin. Advantages: self-administration is possible. Depot preparation can be inserted into the subcutaneous tissues. Example: Norplant for contraception. Disadvantages: it is suitable only for non-irritant drugs. Drug absorption is low, hence it is not suitable for emergency. Transdermal route: the drug is administered in the form of a patch or ointment that deliver the drug into the circulation for systemic effect. Advantages: self-administration, patient compliance is better, duration of action is prolonged, provide a constant plasma concentration of drug. Disadvantages: expensive, local irritation, dermatitis, itching, instability of pH. Case study: a 4-year-old child is brought to the hospital with a complaint of the fever, cough, difficulty in breathing and chest pain. On examination, he is found to be dull but irritable with fast pulse 118 per minute, rapid breathing 55 per minute, and in drawing of lower chest during the inspiration, wheezing, crepitation and mild dehydration. Body temperature is 40 degrees C. The physician makes a provisional diagnosis of the acute pneumonia and orders relevant hematological as well as bacteriological investigation. He decides to introduce the antibiotic therapy. Subject: 4-year-old baby boy. Symptoms includes are fever, cough, difficulty in breathing and chest pain. Object: fast pulse 118 per minute, rapid breathing 55 per minute, in drawing of lower chest during inspiration, wheezing, crepitations and mild dehydration. Body temperature is 40 degrees C. ESR, rest, CRP, rest, WBC count with neutrophils predominant. Assessment: Keeping in view symptom signs, clinical examination and labs infective markers, diagnosis of acute pneumonia is made. Plan. Treatment regimen involve parenteral antibiotic, antibiotic, dehydration. Since the child is seriously ill, a fast and more predictable action of the antibiotic is needed. Parenteral route of administration is right. Moreover, oral dosing may be difficult in this case as the child is dull and irritable. Thank you.